Hey, welcome back to another episode of Out of the Blue. I'm Mike. And today, first off, let me get this out of the way. I apologize for being lax with the videos. Ended up with a really nasty sinus infection that pretty much only just recently semi cleared up. Um, I didn't want to really spend any time making videos while blowing my nose and trying to hack up lung oysters. So, um, again, we'll try to make this a more regular thing. Um, what I'm going to speak about today is something that I've had personal experience with and something that I've noticed is becoming more and more prevalent, which is doctors and nurses that have absolutely zero bedside manner. Now, don't get me wrong, right? If I have something going on with me, I'll take the prick doctor, like the guy in what was that movie? Patch Adams. He's like, do you want the guy who's gonna make me laugh, or do I want the prick? Because when my time comes, I'll take the prick. Um, if the guy knows what he's doing, or the girl knows what he's doing, like what she's doing, like yeah, okay. Doesn't really matter that much to me whether or not you're nice to me. But here's the thing: um, positive, like positive vibes, positivity, kindness. It's not just um, it's not just a behavior. It's not just this is how you act, like what you're supposed to be, whatever. It helps. Like when you're kind to someone, it radiates with like to them, and it resonates with them. It it heals the 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 mind and the spirit of that person. So if you're nice to them and they're sick, it's going to lift their spirits, which in turn will boost their immune system, or their will to fight, their will to like keep going. So here's the thing: I'm finding a lot of doctors and nurses nowadays don't care about bedside manner. They're just there to collect their paycheck and do their job. And it's sad. Now, don't get me wrong. Before any of you doctors or nurses come jumping on my back and saying, that's not true, not all of us are like that. You're right. I'm not saying all of you are. What I am saying is it's a growing epidemic. Um, Too often, um, a doctor will come into the room with bad news and just deliver it matter of factly. Oh, so yeah, just check the test results, and yeah, you got 6 months to live. Like, think about this: you're delivering, bad news to someone, right? A patient. You deliver it just matter of factly. Now, the news itself is a crushing blow. It's something that's going to punch them in the gut. It's something they don't want to hear. It's already going to make them miserable. Why can't follow it up with something? It doesn't have to be like, oh, I'm so sorry, if you need me, I'm here type thing, because you're a doctor and they don't expect that. But to say something like, look, um, I've been doing this for years and I've seen a lot of things happen. Just because science says, you have 6 months to live doesn't mean that's the case. You could be here for, years. You know, Miracles happen. Um, Science evolves every day. And we're going to keep looking for you. We're going to, keep looking into things to try and help you. You know, Something positive, something that can say, look, yeah, things are bad, but they could get better. With nurses, now this is even worse. I feel like First off, let me state, nurses, you guys are underappreciated. You do 90% of the doctor's work and all the manual labor and get no love. It's deplorable. However, you are also, some of you anyway, or a lot of you, um, are the worst offenders when it comes to bedside manner. When you walk in and someone's not feeling good, right? And they're telling you, like, be gentle with me or whatever. I'm in a lot of pain. And you got to move them. You don't have to be, like, ignore what they're saying and just, like, yank them around like they're a rag doll. If they're saying, like, I'm nauseous, I think I'm going to puke, I need an Amices tray, or I need a bedpan because I'm going to shit myself, like, listen to them. Don't ignore them until it's too late and then get mad when they do it. Um, like, your job, more than anything, is to nurture. You're the nurturer of the patients. You're the one that, yes, you're coming in and you're taking care of them, their body, right? You're also there to take care of their emotional and mental health. Because when someone is sick, their emotional and mental state deteriorates greatly because they're feeling awful, and it brings down their mood. It brings down, like, their spirits. Like, you're there to help them in any way possible. I was lucky. When I was going through treatment, I had some of the best nurses you could ask for. Um, Nancy and Alice, if you're watching, I still love you. You're awesome. Um, what they would do is, there was a show called China Beach that was on at the time. Great show, by the way. Very underappreciated. Um, and in between taking care of patients, they would come in and watch a few minutes with me. Um, Now you might think, what's 10 minutes of watching a TV show with you gonna do? A lot, because it gave me something to look forward to, which in turn boosted my spirits and boosted my health. Um, I've also had some nurses that were the exact opposite. I remember, now mind you, I've never had my inoculations. No, I'm not anti vaccinations or anything like that. I just can't get them because I'm immune suppressed. So because of that, I had never had the chicken pox at one point, and I was in the hospital in the ICU, and the nurse, there was, all the nurses were informed because there was a patient with the chicken pox, right, in isolation, and they were all informed. When you get done taking care of this patient, wash your hands thoroughly. Make sure you use gloves anyway, if you're going to go take care of, Michael. Because he's never had the chicken pox, and we don't want him getting them because it could be bad for him. So I was sitting there and I watched my nurse walk in without gloves, take care of the patient with chicken pox, didn't wash her hands, came straight to me, and I said, "What are you doing?" And I'm gonna take your vitals. No, you're not. You gotta wash your hands. You gotta, Don't tell me how to do my job. I know what I'm doing. I've done this before. P.S. Ended up with chicken pox like a week later. So that's just one example. I've had others who come in and they're paying more attention to their phones, or, like, talking to, like, another nurse rather than the blood work they're doing, or the vitals they're taking. Um, I've had nurses that clomp in like horses in the middle of the night to take your vitals. Now I get it. You're supposed to take the vitals every X amount of hours. That's fine. But we're also trying to rest. The patients are trying to recover. When you come in and you're just waking them up bluntly. Don't even give them a chance to come out of it gradually, and you take their vitals, and then you leave. Like again, there's no there's no you're not there's no personalization that way. You're not being personable. You're just being rude. You're just being blunt, and it's awful. Um, Patients are people, and I think the main issue is a lot of doctors, nurses, surgeons, what have you. I think a lot of you are looking at them as just your job, as just your patients, and that's it. Um, my doctor, Dr. Charles Dodsey, um, best doctor in the world, and I would put him up against anyone because he's absolutely brilliant, not just in medicine but in the ways of the world, and he's always being kind and being personable, asking how you are. He hugs everybody. He hugs every. I'm sorry, but the power of a hug from the person that's going to be taking care of you is massive. Like, you don't know what that does for someone. If you're a doctor or a nurse and you hug your patient, um, like that does a lot. It may not seem like it would. You may think I'm nuts for saying it does, but it does so much because it shows you care. Um, it's the little things like that. Start remembering that we're people, and we want to get better. Whether it's something as simple as coming in with a cold or whatever to get antibiotics, or something as massive as cancer. Like, be nicer. Start treating us like people. Um, Less cold. We're not. Oh, and that's one more thing before I stop. Doctors, I have no issue with you when you have something interesting or a patient that's unheard of, and you want your interns to take a look and tell them about the case and teach them something. But at least ask. Don't be don't be in with the patient, and then the next thing you know, you're walking in with 12 interns, pre-med or whatever, and just being like, now this subject right here, this person has, blah 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 blah, and he's had it for blah 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 blah, like blah 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 blah. Now what do you think this is? Blah 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 blah. Like we're not in the room. Don't do that. That makes that makes us feel like a lab rat, like we aren't even a person, and it it's really demeaning. It really is. Ask our permission before you do that. Before you bring in a bunch of interns, and if you do bring them in, talk to us. Have them talk to us. Don't talk like we're not in the room. It's deplorable when doctors do that, and it's happened to me a ton. Unfortunately, I have a lot of things that doctors and nurses have never seen before, and because of that, I've been used as that teaching patient a lot. And I've had doctors do it the right way, but I've had way too many do it the wrong way. So please, for the love of all that is holy, like, change how you do that, please. Call us by our names. Don't say patient number, blah, 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 or this patient. We have names. Use them. That's what they're there for. And don't say, well, protocol or, well, tradition. No, no. Hang protocol, hang tradition. That's not how it should be done. Maybe it's time to break protocol or tradition if it means, treating us like garbage. Anyway, that's my rant for today. Treat your patients better, kinder. Hug them now and then. But yeah, that's it. That's my rant. I will talk to you soon. Remember, Um, Smile when you see someone because a smile is free and happiness is contagious and priceless.